operations of Reggae Mills, an entity that operates out of Devon House, by virtue of pictures that went viral, has been operating despite the orders that were issued at the time for the closures of bars, restaurants, and nightclubs. The order was made to close the operations of Devon House because of what was taking place at Devon House. After we met with the management of Devon House, we decided that the wider population of Devon House should not suffer because of one individual who operates at Devon House. I am satisfied that the operators outside of Reggae Mills have been faithful to the protocols, have been doing what is required under the disaster risk order. But unfortunately, I cannot say the same for the operators of Reggae Mill. The Director General in the Office of Disaster Preparedness and Management wrote to the operators of Reggae Mill advising officially of the position that the operations of that facility should remain closed for a period of 2 weeks. At the end of the 2 weeks, only the restaurant would have been able to operate because other activities at Reggae Mill would require a places of amusement license, and Reggae Mills have been operating without an amusement license. Well, today, it is clear that the management and the operator of Reggae Mills has no regards for the protocols that have been laid down by the government as we seek to protect lives in our response to COVID-19. Since Monday, Reggae Mills have been operating happy hour on a daily basis. They are advertising using various media platforms to advertise these events. And what is disturbing, using the images of individuals to promote these activities. I want to make it clear, abundantly clear this afternoon. I have written to the Commissioner of Police advising the Commissioner of these actions, and I've asked the Commissioner to investigate and to take the necessary actions against the operator of Reggae Mills who continue to violate the protocols that have been set out. We will not allow anyone to violate the protocols that we have agreed upon with the entertainment sector. After many weeks of discussion, we arrive at a point that was generally accepted by all players in the business. We are not in a position, ladies and gentlemen, to let down our guards in regards to the response to COVID-19. And I believe that the operators of Reggae Mill have been disrespectful to the protocols that have been laid down by the government of Jamaica, and I'm prepared to take the strongest possible actions against the operators of Reggae Mill. I'd like to advise the public that anybody who goes to that location and is caught participating in any activities that is not permitted under the order could find themselves in problems with the law. And I want to make that clear. We cannot have two standards. We are enforcing right across the country. The operators of Reggae Mill is no different from any other Jamaican. And I would urge the management to cease and desist immediately or face the consequences of the disaster risk management order. We are comfortable, and you will hear later on about some of the improvements that have been made since we have opened the beaches and rivers and the limited outdoor activities that are taking place across the country. There's a saying now in Jamaica that COVID nah keep. That is far from being so. If we notice what is taking place right around us, there is cause for us to be concerned. And we must maintain this level of discipline that is required to take us through this difficult period. And I want to make this point, that any entertainment that is not authorized based on the agreement with the entertainment sector could have effects on the extension that is expected to be considered at the end of this month. I urge the players, especially in the entertainment sector, to be mindful of their obligations. And I have no doubt that these players who sat in this very room a couple of weeks ago and came to a position that is considered to be within the interest of all who are concerned will want to protect the gains that we have made so far. So at this point, Mr. Moderator, I will invite our entertainment member to begin by making his comments on where I have started with what is taking place at Reggae Mills.
Thank you so much, Minister. Thank you so much, Minister. As you had mentioned earlier, the consultations with the entertainment sector have been weeks, months ongoing, because we know the volatility of the sector, the vulnerability of the sector, and the self-regulation that we have to put in place. It is a situation that is very, very unfortunate that somebody within our fraternity is not adhering to the rules, and I am happy that, there are no secrets between us. What is good for one must be good for all, and we have to uphold these standards and self-regulate, because the reality is that Jamaica is far and broad, and we must ensure that we self-regulate the industry under these circumstances. It cannot be a free-for-all. From the response to what we discussed, Minister, over the past couple of weeks, many of the entertainment practitioners, especially the ones who do small events, weekly dancehall events, round robins, which make up the majority of entertainment activity in Jamaica, based on the data, over 60% of the activity. They are very happy that they get an opportunity to resume economic activity. And also their staff, the workers, the tens of thousands of workers in that industry now have an opportunity to earn after 3-4 months of being shut down. So it's a public-private partnership for the health and safety of our country, and we intend to live by those rules and abide by those rules.
Thank you, Honourable Minister. Thank you, Mr. Banky. As we move in a contiguous form, let me invite Dr. Curdell Espinosa Campbell, Acting Director of Emergency Medical Services in the Ministry of Health and Wellness, to bring her opening remarks.
Thank you, Minister Mackenzie, for inviting me on this platform today. Welcome to the guests on our virtual platform and also to our listeners in Radio Land, TV Land, and thank you, Mr. Hill, for inviting me to open with some remarks. We were very disheartened to know that persons that ought to know better really did not practice what we have been spending months trying to get that essential message across, which is not to open your business establishments because we are still in a disaster zone. We're in a disaster. We have a public health emergency in country which requires all of us, singly, collectively, as a unit, as organizations, as a workplace, as entertainment, to abide by these basic rules. Because if we fail to do so, we will not get over COVID in the time that we anticipated. So we have been doing this from March the 10th. We're now in July, going into August, and entering into a new school term. And we're hoping that with the excellent recovery rates that we have now, which is some 88% going on to 90%, that persons are not reassured in the wrong way that this cannot happen to them. It takes one single event to tip the country over into into an area where the resources are so overwhelmed that we may not be able to contain the disease anymore. And so this is what we are trying to avoid. And by highlighting this case, we hope that other persons take note, take heed, and don't repeat what we have been trying to instill in the country.
Thank you very much, Dr. Campbell. And we move now to Dr. Dwayne Vernon, Executive Director of the Social Development Commission.
Thank you, Mr. Miller. Honorable Minister, esteemed colleagues of the panel, those in attendance and those in virtual land, pleasant good afternoon. Today my intention is to focus on the protocols that we have developed as well as the mechanism we have put in place to monitor and to sensitize the public and operators to these protocols. But I must begin by acknowledging the tremendous work being done by our Honorable Minister, Desmond McKenzie, with regards to his leadership in this trying time, the commitment, the hard work, that sometimes we wish he didn't work so hard because it means that we have to be here many times. But we really have to thank him and commend him for the leadership, leading by example. So thus far, we have developed 14 protocols for different recreational and entertainment spaces. I will list them quickly. These include community bars and taverns, sports bars, gaming lounges, dining in for restaurants, because restaurants were not closed, but they had to do takeout, but now they can dine in. So we developed protocols for those. Zoos and parks, cinemas, playhouses, amusement parks, gyms, small outdoor events, summer camps, daycare centers, beaches and rivers, and rafting. So that's the 14. I must note that all protocols resulted from fulsome engagement and inclusion of the various stakeholders, ministries, departments, agencies, all the private sector organizations of Jamaica, and other interest groups. So we must extend a hearty thanks to them for the contribution that they have made in helping us to develop these protocols. No protocol was approved without Ministry of Health and Wellness giving its stamp of approval. So today we will have enough opportunity to actually go through the details of some of the protocols as well as share the results of some of the compliance audits that we have done. Thank you.
Thank you, Dr. Vernon. And we close out the opening segment with comments and opening remarks from Mr. Richard Thompson, Director General, the Office of Disaster Preparedness and Emergency Management.
Thank you very much, Mr. Hill. Honorable Minister, other members of the panel, all viewers, ladies and gentlemen, good afternoon. Let me start by saying that I fully support the statement made by the Minister that a lot of persons out there have this view that COVID is no longer keeping. It is still out there. It is a very infectious disease, and what we keep saying to persons that we should ensure that all the necessary protocols are observed to ensure that we do not erode the gains that we would have made over the last 3 months. I am sure many persons who would have been seeing what has been happening further afield in other countries and see the kind of devastation that this very infectious virus is having on the world. And we would have made a lot of gains in Jamaica in terms of the measures that we have put in place to reduce the spread and to contain COVID-19. And as was said by Dr. Vernon, I think we really have to commend the minister, our minister, Minister Desmond McKenzie, for the work that he has done, and also commend the cabinet for the work that they have done. Minister have us here on a regular basis. I remember Dr. Vernon asking Minister if he's not going on leave, because we are here constantly, but it shows the passion that he has in terms of ensuring that our population is safe. We are also in the middle of the hurricane season that has been projected to be a very active one, and we are seeing the development of numerous systems on the horizon. So far, we have gone 7 in terms of the development of systems. And I'm sure a lot of persons have been tracking on social media the newest system out there, which is Tropical Storm Gonzalo, which is presently east of Barbados, moving at about 12 miles per hour in a westerly direction, with wind speed up to 65 miles per hour, gusting up to 100 miles per hour, and with a lot of the projection showing it tracking very close to Jamaica. So with our response to COVID-19, us being in the hurricane season, it put greater emphasis on the work that we are doing to ensure that we are doing all the necessary things to protect our people and protect our economy. There's a thinking as well that there's a strong possibility that this present system will become the first hurricane for the hurricane season so far. We are tracking it. The Office of Disaster Preparedness and Emergency Management and the Met Office is tracking the system, seeing what is happening out there, and we will constantly keep the public up to date as to what is happening in relation to that system. And we will also continue to do the work that we have to do to support our minister in the overall work in terms of COVID response and also the overall preparation for the hurricane season.
Thank you, Mr. Thompson. And as we move into the next segment, I'd like to, with your permission, Minister, just to bring to the public's attention, for their own edification and education, the Jamaica Gazette supplement of the Disaster Risk Management Act, now here entitled Disaster Risk Management Enforcement Measures Number 10, Order 2020. And interestingly, Minister, just to remind all of us that under Section 12B and C, it says that each person at such a gathering shall maintain a distance of at least 182.88 centimeters or 6 feet from other persons, popularly termed as social distancing. And Part C says, when in a public place, which for the avoidance of doubt includes a workplace and a licensed public passenger vehicle, each person shall wear a mask fitted to that person's face so as to cover that person's nose and mouth. As we move, Minister and panel, into our questions, the first question, as you had started, Minister, it asks, will the Minister tell me why nightclubs are not given the opportunity to reopen? The Minister is to remember that it's not only rich people own clubs, but poor people do as well. Minister?
In response to that question, it is something that the administration has been thinking about. But if we look at what is taking place across the world, a lot of the problems came out of churches and nightclubs. It's difficult for us to consider the reopening of nightclubs at this time because nightclubs are difficult to manage, and I'll probably ask Doc to help me in responding to this one. But what has been happening, and Kamal, you would have heard some of this, a number of persons who are operators of nightclubs, who have outdoor areas that could be used to facilitate activities, have written to us seeking permission to stage those events outside instead of an indoor location where the circulation is going to be limited. And not all nightclubs can open their doors and their windows as bars would. So it is against that backdrop and against in response to the legal and the medical advice. And I want to make the point, Dr. Vernon made that point earlier on, but I want to restate that position again. All the areas that we have reopened on a trial basis was done once the Ministry of Health recommended. The protocols were worked on, the Ministry of Health examined those protocols and gave the go-ahead. We cannot proceed without the guidelines of the Ministry of Health. We have already worked out some protocols which we have forwarded to the Ministry of Health, but they need time to consider whether or not it is so. So, could you just take this other aspect of the question?
Thank you, Minister Mackenzie. So that's important. There is an adage that says, learn from the mistakes of others because you may not live long enough to make them all by yourself. Okay. And the same goes for COVID. When we look at what is happening internationally, we have to look at the best practices, look at the worst case scenarios that have come out of those reports, and implement them in country and use those as markers that we don't end up in the same way that we see happening in, say, Florida. And so, for instance, where we have had an input in planning to reopen some sectors, we also continue to monitor and evaluate those sectors that we have agreed upon just to ensure that there are no clusters of cases developing in those scenarios. So it's not giving permission and leaving you up to your own devices. We continue to evaluate just to make sure that we are doing the right things.
Come on.
Thanks, Minister. My personal opinion is that there are two activities where social distancing is virtually impossible. One of them is public passenger vehicles that are close, but the mitigating factor for those is obviously wearing a mask. When you go into a nightclub, it's also meant to be very close. You feed off that communal space, but you don't wear a mask because you're typically consuming beverages. And that is where the risk is. When you have an opportunity to go into a nightclub that is open air and proper circulation, that becomes a much more feasible option nowadays with the new normal. So that is something that I want us to seriously consider and see how we can work on that. But of course, you know, as I said, there's significant risk with the nightclub situation for enclosed spaces.
Yes, I just want to continue from that point that you've made. Is a very important point. Remember that the virus is transmitted through droplets, through direct contacts with contaminated surfaces. When you have persons in an enclosed environment, especially where you may be asymptomatic, you may not know that you have the virus, there is ever the increased risk of transmission of that virus. And we also want to remember that whilst we're still in the clusters of cases, if we progress to the community transmission of the coronavirus, we may have to revert and lock down everything again. And this is where we don't want to go. Whilst we can go back to the less transmission scenario based on the epidemiological cycle, the isolated sporadic cases, where your risk of transmission is lower than clusters of cases, we have to remember that in the nightclub scenario, especially when persons are drinking and may not be conscious of the social and physical distancing that we are recommended, the risk of promoting and transmitting the virus is that much greater.
And just the first part of the question, one part of the question states it is not just rich people alone or nightclubs. Let me say that the coronavirus has no respect, whether you're rich, poor, black, or white. You know, anyone can become victims to the coronavirus. So I would urge my fellow Jamaicans not to look at this situation as a situation of privilege. The steps that we are taking is to protect every single Jamaican despite of their social position. And there is no social position. The only position I know right now is survival. And that is what we have to be doing collectively as a people in the fight against COVID-19. You know, the Office of Disaster Preparedness is critical on this subject. So,
yes, Minister, thank you. I think we have been going through the grinds in terms of looking at the various protocols, and especially the one on entertainment. We have spent significant time with the entertainment sector and the entertainment industry in terms of looking at those protocols. We have seen where across the globe that a lot of the transmission, and COVID-19 is very infectious. A lot of the transmission do happen in closed spaces. And Nightclub, as was said by Kamal, provides for that in terms of the kind of closed spacing that operates in nightclubs. And it is very difficult at times to control what happens once alcohol is being consumed and person get intoxicated. All the inhibitions go out the window, all the senses are impacted when you start consuming alcohol. So it makes it difficult for you to practice the necessary protocols that we would have put out in terms of the overall control of COVID-19. So in essence, I think that's where we are, Minister. I think throughout the process, there is not a separation whether you're rich or you're poor. It's to look at the country itself and what we have to do to protect our economy and overall protect every single person in the country, whether you live in Norbrook or you live below Tarrington Bridge. The virus is not a respecter of wealth or color or creed or anything like that. And the work that we have been doing is about every single person.
Thank you, Dr. Vernon.
Yes, thanks, Minister. Without repeating how conducive the club environment, the nightclub environment is, I just want to remind our listeners, our viewers, that the first set of protocols we work on was actually community bars and taverns, because we were cognizant of the impact, the economic impact that the closures were having. So the ministry, the government, has been very focused on all sectors of the society. So please just balance the views with the order in which we have been working on the protocols. I would just say that, Minister.
Thank you, Minister. Thank you, members of the panel. Our viewers are being reminded to send their questions and comments via our social media platforms or text or WhatsApp to 876-298-6508 or 876-298-6258, or call in on our toll-free line at 876-618-8248. As we move to another question that came in, and the question asks, Minister, and this is particularly for you, twofold. Question from West Kingston. How long will the restriction of 250 people in a party last for?
Well, I'm going to ask Kamal to respond first, because I want to make this point, which is critical. Those numbers were arrived at after we did an island-wide survey conducted by the SDC and the industry, looking at venues across the country that is used on a regular basis for the staging of events. So that figure was not arrived at by me alone, but it was out of consensus. So come on.
Thank you, Minister. So I can't answer the question about how long.
I will answer that part.
Excellent. But the amount of persons was a figure that was derived based on our internal consultations. The Entertainment Advisory Board at the Ministry of Culture, Gender, Entertainment and Sports had a two-day series consultation with over 300 participants from various sectors of the entertainment industry, from visual and performing arts, nightclub, bar personnel, events, weekly dance hall, musicians, etc., selectors, whatever. And based on the consensus, we said that the entertainment industry needs to actually open up in 3 distinct phases. And what would need to happen is that we need to show proficiency in self-regulation in phase 1. Once we're able to show that, then we can quickly move into phase 2. So we're here now saying to everybody that is in the industry, please make sure that you abide by all the protocols, because once we're able to do that, the Minister of Local Government can swiftly move to up those numbers once he's confident that the self-regulation and all the protocols are being followed to a T.
Now, the response to the question, how long? Just to advise the public that the policy of the government, since we have started the phase reopening of not just the entertainment sector, but to take everything on a 2-week basis. So we operate for 2 weeks, we do an assessment, and at the end of that 2 weeks, we give a further extension for another 2 weeks. So we are gradually phasing in the process of the reopening, and this first phase will come to an end on the 31st of this month, when we will review and to see how well the protocols are working. But if we throw into the mix what is taking place at Reggae Mills, then it doesn't look, I would say. But the point is that once we are satisfied, and the SDC, Dr. Vernon will probably speak a little more about that in the next round, but we are constantly monitoring, and I don't want people to believe that we just announce these protocols and nothing happened. We have people out there visiting every area that has been placed under the order is being monitored and will be assessed when the period expires.
Thank you, Minister. And interestingly, Minister, the orders under Section 14, subsection 14A, just to bring to our attention that no more than 5 persons, and this is related to bars, and more than 5 persons, including bartenders, are permitted to be in the indoor area of the bar at any time, and customers are seated only at the outdoor table seating area of the bar, and no more than 2 persons are seated at each table outdoors, with no more than 10 customers at a time at the outdoor area of the bar. So these measures are indeed very clear, Minister, to include all gaming machines at the bar are spaced at least 6 feet apart, and that the provisions on other paragraphs ensure that the social distancing and mask wearing are a must enforced activity. Another question, Minister and panel, including why is Emancipation Park closed? Is there an order for its particular closure?
Well, we granted the order to reopen parks and amusement areas some time ago. But before I came on here, I spoke with the managing director of the National Housing Trust, who operates Emancipation Park. The reason why the park was not open before, the protocols that was set out for the opening and the operation of public parks, the Emancipation Park management wanted to ensure that those protocols were in place, and he advised me that the park is now officially open to the public, including all the requirements that has been stipulated under the order by the Ministry of Health and the Ministry of Local Government. So Emancipation Park is open for business.
Thank you, Minister. As relates to another question focusing on daycare, and of course that is again under Section 14, subsection 20, and the question asked, is the government going to extend the period of operation for daycare facilities? If not, why? What would be the reason not to reopen them? Parents, like myself, use the facility of daycares. Minister?
Well, I'm going to ask Dr. Campbell to answer. If we don't reopen, what would have been the reason for not extending the reopening? because it would have to be something of a medical nature. And I want the doctor, in the protocols, we had set out strict guidelines as to what should be the ratio between a child and the caregiver. And what are the requirements, the medical requirements that is necessary to protect a child when they leave the confines of their parents' arms and go into a daycare facility. We have to be careful of the medical requirements. Yeah?
Yes, thank you, Minister. As a matter of fact, I noticed that that very topic came on TVJ News a couple of nights ago, where there were some operators of the nurseries who were very concerned that they were not given permission to reopen. Now, let me first say that the nurseries on a whole tend to be quite good when it comes to their hygienic practices. So far, we haven't had any outbreaks before COVID or after COVID where children became ill for one reason or the other. So they have been very good. So the measures they already have in place are quite robust. There are some issues to be ironed out. I'm not sure how soon they will be ironed out, but certainly with the environmental health team, we have to sit down and define some clear parameters for reopening, because as you know, children are in different stages of development. You have some pre-verbal children, they may listen, but they can't necessarily speak. You have children who are up and running, they certainly cannot listen when you say, don't touch or don't do this, because their natural tendency, developmental-wise, is to touch, and to touch their mouth, their hands, and contaminate surfaces. So whilst we recognize that is an essential area to be reopened, we have to draft in other specialists, such as the pediatric team, the Pediatric Association of Jamaica, etc. So I can't comment any further on it, but certainly it's something that is on the radar for further discussion.
Thank you, Dr. Campbell.
Okay, thanks, Minister. It's a very sensitive area, of course. This one has the most protocols developed. So in the interest of this topic, I will start with the ratio mentioned by Minister in terms of the staff to mentioned by Minister in terms of the staff to children ratio. So we have here that for each group of children aged 13 months and under, we must have 1 adult to 5 children. For each group of children aged 13 months but less than 3 years, 1 adult to 8 children. For each group of children aged over 3 years but less than 5 years, 1 adult to 10 children. If I may just add a few more of the protocols that we consider crucial. No child under the age of 5, we are saying, should wear a mask because of the respiratory development, just to state that. And quickly, that an isolation area shall be established and maintained at the daycare center. And of course, must all the parent or guardian to, as quickly as possible, pick up the child if the child develops any fever or gastrointestinal matters. And you need to have more thermometers than you normally would. So there are some costs, yes, but it is crucial given how sensitive this environment is. Minister?
And just to say to the caller who sent in that message, as I said before, those new orders that I announced in Parliament a couple of weeks ago will be coming up for review at the 31st. And once we are satisfied, based on the constant inspection that we are doing, that everything is in order, then it can be recommended for a further extension for another period.
Thank you, Minister. Again, we want to invite our viewers and listeners to text or WhatsApp us on our lines at 876-298-6508 or 876-298-6258, or call in on 876-618-8248. A question here has come directly to Mr. Kamal Banki from Psycho Henry, and it is Psycho is spelled S-A-I, just to be clear. Henry on Facebook. What are the 3 phases of reopening, Kamal? That's the question.
All right. So the 3 phases of reopening have to do with the size, the capacity of the different styles of entertainment, and also the actual different styles of entertainment. So if you understand that phase 1 would be 250 people in an outdoor environment, phase 2 would have been proposed at a larger amount of persons in the same environment. And then, of course, we go by, let's say percentages with, as the minister would have announced, with sports bars and those kinds of things. So I believe it's 60% for sports, right, 6% for sports bars. So phase 2 would see that move up to possibly 75%. And this is kind of how we're moving in the phase reopening. And as I said, this was done through consultation with the entertainment sector. So you're going to see an ability for phase 2, once we reach to that stage, assuming we adhere to all the protocols, where we're going to be able to have much larger events than 250 persons. And phase 3 would be larger than phase 2, of course.
So in response to that, again, they say encouragement, sweet labor. So if we are seeing the kind of response, and I want to say this here, I want to lift my hat to the owners of the taverns and the community bars. They were one of the first real areas that we responded to, and we opened that section. Granted, many of them have lost their way since, but based on the survey that we are doing, they have been consistent, living up to the protocols that have been observed. And I think it is safe to say that we can now revisit the operation of taverns and community bars to see if we can now move those numbers to a different level.
Let me just say, it's not automatic that we move from phase 1 to phase 2 to phase 3, because at any time, if we enter into the community transmission of COVID-19, we have to revert. And we'll have to cancel and postpone and revise all of those protocols that we would have rolled out. So I just want to remind the listeners that if we end up having community transmission, we have to just stop everything.
And the Prime Minister is on record as saying that if the numbers get out of hand,
absolutely,
then we have to take tough decisions.
Right.
And it is important that the country understands. While we are cognizant of the vast constituents of Jamaicans who rely on the entertainment sector for a livelihood, because in my own constituency, I mean, I have dance almost every second. You have brunch, you have breakfast, you have dinner, you have nightclub, you name it. Parties of all sizes and names. But it is important that there is this appreciation that the government will have to react if it becomes necessary.
Thank you, Minister. Thank you again, panel. Minister, this question is coming out of Portmore, and it certainly relates to Section 6 pertaining to rivers particularly. The question asks, the house is hot, I live in Portmore, and my children want to go to a river party. It's summer now. Can the minister, as it quotes here, boss us?
Well, I don't know what they mean by boss us. One thing I can say that we have open rivers and beaches. What we are saying is that the events should be limited to minimize as much social contact as necessary. You are free to jump into the river, jump into the beach, but ensure you do so and protect yourselves. I got a letter from the superintendent of police out in the Bull Bay area seeking assistance in erecting signs out at the Bob Marley Beach, I think it is, out in the Bull Bay area. And I sent a copy of that letter to you at the KCC.
Yes, sir.
Because over the last couple of months, several persons have lost their lives swimming in that area. And we are not against persons swimming, going to the beach or going to the rivers. But what we are saying, observe the protocols. And Dr. Vernon, what are some of the protocols as it relates to beaches and rivers?
Okay, thanks, Minister. I will just state, Minister, because you mentioned earlier about the compliance of the bars and taverns, which is 72% compliance. At beaches and rivers, we're looking at 42% compliance and from the last report. And this 42% compliance is actually a 20% improvement. So you can imagine what it was like. So certainly we have challenges at the beaches and rivers with regard to social distancing, wearing of masks when you're not in the water. So just a reminder of some of the areas. Beaches and rivers may be open between 6 a.m. and 6 p.m. No group of more than 20 people shall be allowed to congregate at any section of the beach or river, and all such gathering areas must be at least 6 feet apart. Distancing markers, and this is an area that there's a significant challenge because we are not seeing these at most places. Distancing markers such as flags, signs, cones, and ropes shall be placed to facilitate compliance with the requirements specified. For beach share shall not be provided by the operators of the beach, but persons visiting the beach shall be permitted to bring their own chairs. And this is a big one. Activities at beaches and rivers shall be limited to swimming, exercising, and sunbathing. Remember that the protocol for small outdoor events actually says should be in a controlled space, meaning a perimeter. So, Minister Prof, we need to examine these areas that actually have controlled spaces in and around beaches and rivers to see if those spaces can also be considered. Finally, vendors shall not be permitted to walk beaches or rivers with items for sale. All that I have just read, though they are not exhaustive of all the protocols, but these are the areas that we have been having challenges when we look at the compliance, Minister.
Thank you very much, Minister. We actually do have a caller online. I'd like to invite the caller to pose his or her question at this time.
Hi, good afternoon to the Minister and the panel.
Yes, good afternoon.
Good afternoon.
Good. So my question is to the gentleman from the Met Office. Really, the system that is out there, I would like to know if it is going to affect Jamaica, and if we are going to get any rain from it, because we well need some rain.
Well, I know we well need some rain. We're in a drought, and Minister has been talking about that, and we have been making steps to deal with the drought condition. But in terms of the system itself, it's very early days. Some of the is a bit east of Barbados at present. And for us in Jamaica, it's very early days now. The Met Office has been saying that at present, the system is of no threat to Jamaica. But what we're doing, we are monitoring the system, and a lot of the projection from the meteorologists are saying that it might, if it develops further and tracks close to Jamaica, then yes, we will get some rainfall from that event. But it is still very early, and as you know, weather system is not really an exact science. So it can develop into a hurricane, or it can dissipate as you get further into the Caribbean waters. So it's very early, and we are monitoring it, and we will give the information as we get more information out to the public. So you will be kept abreast as to what is happening in relation to Gonzalo.
Thank you, Colin.
I just want to say something on this question. We have been preoccupied since March with COVID-19. The country should be aware that we have had more earthquake shakes this year alone than we have had since the beginning of this year, that we have had in the entire last year and the year before. In the last 2 to 3 weeks, We have had about four
felt.
Four felt across the island. So it tells you that we are in a period where one, earthquake is not something that we can predict. So again, we have to be very cautious when it comes along to the question of earthquake. We are now moving deeper into the middle of hurricane season. And already we are seeing activities that are taking shape. We are experiencing a severe drought in the country at this time. So those are areas of real concern. So as a country, we need to be focusing our attention on the COVID-19, on the frequency of earthquakes, on the existing drought situation, and the fact that we are moving deeper into the hurricane season, which poses severe problems for us as a country. We have not had a direct hurricane since Matthew was the last one that threatened us significantly. That went away. We have had floodings over the last couple of years, but we must, as a country, prepare ourselves for the eventuality. Anything can strike at this time. Okay? So that is in response to the question of the caller, that we should be on alert as a country right now based on the challenges that we are facing.
Thank you, Minister. And we have yet another caller online. Caller, you may go ahead with your question to Dr. Espinosa Campbell.
Yes, good afternoon. And I'm hearing you loud and clear here in Radio Land. Congratulations. Dr. Carnival Espinosa Campbell, are you hearing me, please?
Yes, I'm hearing you. Good afternoon.
Yes, good afternoon. I just want to say that thank you for your lovely presentation, especially the warning about those who don't look at the mistakes of others. I thought that was a very nice warning. However, my question is directed to you. As you know, we are $120 billion in the hole because of COVID. Production is down because of COVID. Parents have begun to start working, and they need to work so that the economy can get moving. My question is, at what point are we going to get the daycares up and running so that parents can feel comfortable at work, that their children are being protected?
Okay, thank you for your question. I'd spoken to this earlier, but just to say that this is an area that is still under discussion, and as you would have also remembered, the orders would speak to parents working from home. And I'm not sure if there's a frustration because they're working from home with the children around their feet and want to get rid of them, but certainly we recognize that as persons re-enter the workforce, there is a need for respite care and therapy from their children with the daycare. So that is something that we have pledged to look at with all the stakeholders, in particular the Pediatric Association of Jamaica, for them to weigh in on the matter and make their necessary recommendations. So although I cannot speak any further on the matter, I do pledge that it will be discussed at a higher level with the Chief Medical Officer of Jamaica, and we will now put out the recommendations.
Well, just to say though that Daycare has been open because those orders were made by mean Parliament.
The extension of the opening.
The extension of the opening. So to the caller, the facilities are open. A lot of the protocols we are still fine-tuning, and based on what Dr. Campbell said, it is important. But the work from home order is still in place. We have moved the stay-at-home from 65 up to 75, and the daycare facilities are open. Summer camps are open, where we want to advise persons who are sending their kids to summer camp. We have laid out some protocols in regards to the operation of summer camps. Let me make the point and make it clear, because I've been getting calls from persons wanting to find out what is the size of the room and how many persons can sleep in a dorm. The order that was made in Parliament was not for residential camp. It is for day camp only. Day camp only.
Let me just add to that. As it relates to the daycare, remember, whilst it was recommended that they be opened, we also had to give persons or owners of the nurseries time to put all the necessary measures in place. And we would have seen some footage of persons, you know, they may not understand what is required fully, hence the need to go back to the table and draft up the protocol so it is standardized across all areas. So we have to give persons time to put in their isolation areas when a child becomes sick, all the necessary sanitization, cleaning implement, etc., etc. So that will happen in short order. So thank you for the question.
Thank you, Minister. Thank you, Dr. Campbell. There is another call online, and that is directed to our own Minister Mackenzie.
Good afternoon.
Good afternoon.
Yes, I travel on the road on a regular basis, and I have realized that persons are not wearing masks. Entering into establishments, they are not doing any sanitizing, you are not required to wear any mask. Buses and taxis the same. So what is the government doing about that, seeing that the cases are going up rapidly?
You know, the government has a responsibility to provide the guidelines and do all that is necessary. But then there is also the responsibility of the average Jamaican. This is not a totalitarian state where we use compulsory force to get people to comply. If it means that the government will have to now go the route of putting in place drastic measures, and you know, under the Disaster Management Risk Act, the police can prosecute an individual for not wearing a mask. I don't think we want to go that route to be using that level of force. We want people to understand and appreciate that the measures that have been put in place is there to safeguard their own personal interests and that of their family. So we have a responsibility as the elected representatives to put the necessary measures in place, but in order for us to be successful, and that is why we have been talking to the country about this question of the pandemic, to say that this is everybody's business. This is not the business of the government alone. So we are looking at it. I have noticed it. We have raised it in several meetings. I don't go without my mask. I don't go without it because I think it is critical. But I hear you, ma'am, and I will raise it at the next subcommittee of cabinet and to see how we go. But Dr. Campbell made a point, and I want to say it again. If we reach the stage where the government has to take measures to tighten and to protect lives, then we will take and make those decisions.
Thank you, Minister. A question from Ms. Brenda Talbert of Arokabesa St. Mary. Are there any plans to provide water for communities that are experiencing drought?
You know, that is a major problem across the country. As I said before, earlier on, we are experiencing a severe drought. The National Water Commission would have announced restrictions in communities that are served by the National Water Commission. In rural Jamaica, where a significant portion of the water supply is predicated on the services of the municipal corporation and to some extent the National Water Commission, trucking water to various communities. Yes, we are presently working on a program which I will be announcing next week as it relates to trucking of water to various communities across the island. St. Mary is one of the 4 parishes that is high on the list that is experiencing drought conditions at this time. So the answer to your question, yes, we are aware. We'll be making some announcements as it relates to the trucking of water to various communities across the country.
Thank you, Minister. And of course, we want to use the opportunity just to remind our viewers and listeners to text or WhatsApp us on 876-298-6508, 876-298-6258, or call in on 876-618-8248. Our social media platforms are also very active. And we have a question from Facebook. Mr. Peter James Morris asks, we are a private members club with an outdoor bar with a town retail spirit license. Can our bar be reopened to our members? And similarly, we have created a set of guidelines for our swimming pool. Can we reopen to our members?
Well, the order for the opening of tavern and community bars has been in place now for more than 2 months. So there is no problem with you operating your private member bar. The question of the swimming pool is restricted. It's a private pool. It is not actually open to the public like that. So could you take that question? Because, it's a private pool, and we can't determine who uses one private facility.
Right.
But there should be some guidelines as to how the pool is used.
Yes, so the same measures that we have asked persons to take with the physical distancing, you enter into an area, you want to sanitize your hands. The same things that you do in public is what you'd also implement in those indoor areas. So it really is no different. And of course, pay attention to the numbers of persons gathered within the total space. So we just ask for the same things to be implemented.
Okay, thank you, thank you. Another question coming in from St. Catherine. What is the protocol related to 9 nights and setup? Can we have these?
This one is a headache.
Dr. Vernon, those would be considered banking as the outdoor, small outdoor event.
Yes, there's a provision for religious celebrations and festivals.
Right. In the order. So you can go ahead and give me that, Dr. Vernon.
All right, just a reminder of the what we classify as small outdoor events. These are small outdoor concerts, parties, tailgate parties, round-robins, launches, religious celebrations, and festivals. So I would imagine that those 9 nights and others, if it is within an enclosed environment, not necessarily closed meaning or ceiling, but a perimeter wall or a fence, and with less than 250 persons, if the physical distance allows for that, then those can happen.
Right.
Can be classified as a religious event?
Right. It can be deemed a religious events, but again, when we do have those events, and Banky will know that, it sometimes turns into a session. And, the protocol would be breached. But I want to just say, and I think in the final portion of the program, we could turn our attention to the requirements to hold events, because I think that is critical to what we are doing. What are the requirements and what people must do in order to have events? So I think we could respond to that a little bit later on down into the program.
Okay, thank you, Minister. We do have a call online directed to Honorable Minister Mackenzie. Caller, you may go ahead.
Okay, my question is related to the Independence celebration. We Jamaicans are accustomed to celebrating quite a bit round about this time, and I am sure that persons are still looking forward to celebrating, whether it is with the national celebrations or just generally that family kind of feel and entertainment. Will any considerations be given or anything new be developed as it relates to our celebrating, going to beach or river or kind of activity during this time? Will there be anything specific for that?
Well, the Minister of Entertainment, I know they are working on what is being considered as the approach for the Emancipation Independence celebrations. You would have noticed that the Jamaica Festival song is being staged using a virtual platform for the presentation of the songs. We are still operating under the order where the restrictions are still in place. So I would assume that any form of celebrations in this year's independence celebration and all the associated activities would have to be done inside of the protocols that have been set by the government. And I know Minister Grange will probably speak to that later on before we get to the end of the month.
Thank you, Minister. Thank you, caller. This one is directed at Mr. Kamal Banki, I suppose. It says, when will Carnival in Jamaica be held, if at all, as I cannot imagine that being held virtually? On the spot, come on.
I cannot imagine that either. Back in March, you know, the Carnival in Jamaica stakeholders had consultations with the Ministry of Health and Ministry of Tourism, Ministry of Local Government, Ministry of Culture, Gender, Entertainment and Sports. And we actually, from as early as March 9th, said that we were going to postpone Carnival in Jamaica. At that time, I mean, obviously we would never know what would have happened in this current pandemic. And we said, you know, we wanted to put it to a far, far, far date away. Some dates were considered during the summer period. At that time, that would have been feasible in our minds. But we said, let us be cautious. Let us actually give ourselves more than enough time. And the date of October 25th was actually set and announced at a press conference at the Ministry of Tourism. Again, that was done in March. We have not had any consultation with the Carnival stakeholders and the government since that. What the Carnival stakeholders, through Entertainment Advisory Board and the other stakeholder community groups, would have been doing is lobbying for the small phase 1 reopening and ensuring that we can move quickly to phase 3, which you know, after phase 3 would be no restriction, but phase 3 would be no restriction, but quickly to phase 3, where possibly that can be allowed. The quicker we get there is the quicker that we can say, well, this is a definite go, and the government will say 2 thumbs up. But the only way to get there is self-responsibility, adhering to the protocols, and ensuring that we do manage ourselves responsibly to ensure we're safe while partying. This 2-week initial reopening, Minister, is a great test of the industry to see how we are going to be able to comply, and if we can actually comply. There are many naysayers out there, but there are also many proponents of the craft that will say, listen, we can do this, we are responsible individuals, but the reality is that the only persons that are going to benefit or suffer are the persons themselves that are putting in place the protocols or not following them.
And I really appreciate those comments, because what this speaks to, ladies and gentlemen, is this collective response to the crisis. We did not, as a government, take it upon ourselves to put the restrictions and then give the order. The discussions have taken place. But I'm surprised that you did not mention, I was listening, I think it was Nationwide one morning, to hear someone, I think from Trinidad, talking about bumper to fender. I don't know what that means as a part of reintroducing Carnival. I don't know if you have listened to, you have heard that.
Tailgate Carnival. Yeah? Like a tailgate Carnival.
Well, I don't know what it really meant, but I don't know if it's the tailgate kind of entertainment.
Minister, there are two very distinct interpretations of bumper to fender.
Okay.
There is the tailgate interpretation, but
Yes.
more than likely, it is the dancing interpretation of person-to-person, close person-to-person interaction. Very
You
close.
should call that COVID.
Very, very close, Minister. But the reality is that, you know, Carnival comprises many different forms. It's
Yes.
not just a huge road parade with spectators. There are numerous fetes that can happen under the current operations and limited capacity. So there is nothing that precludes somebody from having a Carnival fete right now under these current limitations. Obviously, as we go further and the phases roll out more and more, we'll speak about how we can actually safely have a road parade and what that could look like. But that, as I said, October is a long way away. And we're considering things and working with your minister and other government agencies and the Ministry of Health on a 2-week basis.
Yes.
So we are trying to put in place the things for 2 weeks at a time. And we work hard at it, and it's assiduous work, and we hope that everybody works with us to get it done.
But you know, Banky and listeners and viewers, just throwing this out for the panel. I used to play disco. But I remember in my younger days, you go into Glass Bucket, you go to Sombrero, you go to Subway, you go to Peyton Place. I am dancing at one end of the room, and my partner is at the next closeness of the dancing. So I don't know what Dr. Vernon thinks about it.
Different times, Minister. But I agree. It depends on what you like, teach to each his own. But certainly, the limitations that we now have, 250, really and truly, when we look at the types of venues that we have seen, we have identified around 717 venues that can easily host events right now. So you can have your 250 and you can dance, whether it is a spin down and return. But certainly we are not encouraging the bumper to fender at this time because they are not going to be wearing your masks. So I would say these events can take place, dancing can happen, and we want to encourage promoters as much as possible to be responsible. And as Mr. Banky has been saying, the industry belongs to all of us, it's not just you. So be responsible.
Thank you. And as we bring this conversation back to PG, let me just refocus on section 17 related to cinemas. And it says, part C says, signage advertising all the requirements governing the use of the cinema to include the requirements of the subparagraph shall be conspicuously placed throughout the cinema, including at each entrance. No more than 60% of the persons that can normally be seated in the cinema shall be seated at any time, and a distance of at least 2 seats shall be maintained between the back of a seating row and the front of the next seating row. Just some points for us to remember, and we will throw to Dr. Vernon to expound on those measures and those orders. Dr. Vernon?
Sure, thank you. Just to say that when we did the compliance of the cinemas, looking at the Cineplex in St. James, in Montego Bay, St. James, in Portmore, and at Carib, also is a multiplex at Ligani. The compliance rate was 100%. So we really have to say a big thank you and recognize the management of Police Amusement for the tremendous work that they have done. So in addition to what you read as the protocol, just the one way in, the one way out is being strictly enforced, and they have also closed 2 middle rows to allow for persons to cross the floor of the cinema. So excellent work is being done. Sanitization, they have put in major stations in the center of the lobby. So this is our model, Minister, again, much better than the 72% we have for bars, and as good as bars was. At 100%, we really have to thank and recognize the management.
And I noticed some advertisements going out and some theaters now opening up for plays.
Right. Yes, so it's free advertisement, Minister. So this weekend, at the Little Theatre, they will be having a series of shows, which they call a test run. And the organizers, Mr. Summer, they were so good to email, to WhatsApp me the flyer with the caption, "Come monitor." So I guess they have everything in order. So we'll certainly be there over the independence and emancipation period to observe what is taking place. And it is interesting because this sector has been saying that the 60% might be a challenge to them, but they are willing to take the chance. So again, this is the type of partnership that we need to get out of this trying time. So we'll be there to support them and to help to sensitize the persons who will be in attendance as to the protocol. The major thing we're going to be looking for is that distance between the stage and the first occupied row. So let's bear that in mind. And certainly wearing a mask on the entrance, the temperature checks. So Jamaica, please go out and be safe and have some fun.
And I remember Basil Dawkins, when he was here, he had raised the point that they would not be taking up the offer to open just yet. They would want to see how it works and to have the necessary rehearsals, because the live theater is different from the actual cinema. Yes. The demands are much greater. But again, I just want to say, you know, we are feeling comfortable, Mr. Banky, yes, based on the reports that we've been getting on the entertainment sector. I got a report on a round robin, and I can't believe that was a round robin based on how the persons attending the round robin was participating and observing the protocols.
Thank you, Minister. Thank you, panelists. We have a caller online, and caller, you may go ahead with your question.
Good afternoon to the panel.
Good afternoon.
Yes, and I hope you're all doing well, regardless of the tough times we are going through.
Yes, thanks.
Okay. My thing is, I have something to say to the nation in passport. And it goes like this. Jamaican people, on the most ear, if one did hear, things would be better on a 2 hour age. Everybody asking when this or when that's going to open back. And nobody not taking this thing, or most people are not taking this thing serious. They want as if they are on their own. And when attackers strike, the burden fall down on everybody. All right. Prime ministers and the ministers, at first they said, it is not a death threat and all of that. You see from the people in here that is like they said, sure, we're not going to dead, so we're not too worried. And then start towards them have a life. You see some videos like, okay, them because Jamaican people afraid of death. They're more serious, but sorry when they tell them say it's not a death threat. And they shouldn't say nothing to them like that. One people to say, because from them hear that, like, they don't get Lego like when one leg out of it. No, man, they need to go on better, man. They're not hearing. Most of them, they're not hearing.
We are an open government. We believe that communication and advising the country of what exists is the best way to go. And that we have built up a certain level of confidence, and the people have returned that confidence in the government, and we think we are obligated to speak to the country about what is taking place. While it is true that the coronavirus is not a death threat, we have indicated, and Dr. Campbell could probably touch that, the areas where persons become vulnerable. And as you rightly said, people must be prepared to listen, you know, and not to take things for granted. Not because we have opened up in a partial way some 14 areas within the last 6 weeks or so. It is not an indication that we are out of the woods. The economy of the country has to grow. We cannot afford for jobs to be lost. There is a law that we have that speaks to redundancy. We don't want persons to start getting letters that is going to make them redundant. We have to be cognizant of the challenges that we face. And we also, most importantly, have to remember the frontline workers, the nurses, the doctors, the porters, the technicians, the drivers, all the persons who have to be carrying this burden of COVID-19 on their shoulders. And I am supporting your argument that the Jamaican people need to take stock, revisit. Not all of them. I believe that the greater majority of Jamaicans have been very responsive to the call. They are trying their best, but there is a percentage, and just 1 out of 100 could have a devastating effect on the country. Yeah?
I agree with you. I mean, for the most part, our Jamaicans have listened to the advice, except for a few aberrant persons. The main issue now relies on the controlled reentry program, where we have persons returning into the country. They're approved for reentry with the understanding that they have to quarantine mandatorily for the 14 days. But what is happening now, they break the rules. Quite simply, they break the rules. Some of them come into the country with the sole intention of attending funerals or other events, and then they exit without us knowing. That's one. And I mean, to date, I think we have about 260 persons who have come into country who have registered a positive test result, okay? Plus we have the Alarica cluster, which was 235. So we now have to redirect our efforts into the controlled reentry program to make sure that we are enforcing the measures where those persons are quarantined and they do not go into the community to cause community transmission. So again, I wanted to commend those persons who have listened to the message, stuck to the plan to help us get over this, because I think we have about 60 or so active cases in country now, which is really excellent results as we look at their recovery rate of almost 90%. So yes.
Thank you, Minister, and thank you, Dr. Espinosa Campbell. Again, we want to just remind you to keep active our text and WhatsApp message boards at 298-876-298-6508 and 876-298-6256, or our toll-free line 876-618-8248. As we take a quick look back, Minister, at the orders, as Section 15 speaks to the temporary closure of educational institutions. And a question has come in from Kingston. Is there any strict monitoring of schools, particularly during this exam period?
Yes, there is. Yesterday I had the privilege of meeting with the principals and chairmen of boards of schools in my constituency. I had extensive discussions along the reopening of schools and what is presently taking place. And I know that the Minister of Education, working closely with the Ministry of Health, have been having extensive discussions. And up to this morning, I heard the Minister of Education speaking about phased reopening of schools on a basis that will be done to have a general assessment of how we are coping in response to COVID-19.
Right, and I just want to add that the Health Promotion and Protection branch within the ministry, along with the environmental health team, have collaborated greatly to draft up the protocols and to continue to provide assistance to the Ministry of Education as they continue to reopen their schools. So they work together very well.
Great, thank you. And we have a question from two questions actually from Facebook. Ricardo Goldburn asks, can you go over the protocols? I suppose for Dr. Vernon. Can you go over the protocols for weddings, please? I don't know if he wants to escape that. But
that one is coming in. What we have said about weddings, and I'm looking at some messages on the page. I noticed that Juliet Beckford has stated that we are speaking about all events and parties, but we have not mentioned churches. Let me say that we are satisfied with the response of the churches in regards to observing the protocols. I have had the pleasure of going to a number of church services up to Sunday gone. The Prime Minister and myself was in attendance at Webster for a special church service where the protocols that have been laid down, the sanitization and the social distancing was well in place. I know there are some concerns that have been raised about the 50 persons within a church. And the reason why we have put in the number 50, if the church can see more than 50, once you can get in the social distance with more than 50, then, you know, we are asking to do so. But in the case of funerals, we are putting restrictions on the number of persons that can be in a church for a funeral service, because a funeral service gathers emotional response. So persons will want to hug and tears will flow. So we are saying that the restriction on the number of persons to a funeral service in the church must be predicated, one, on the size of the church. So we are saying the number is 50. So, but if the church can see more, getting in the social distance, then that is not a problem. Weddings, we figured that weddings is not so much that emotional as funerals. And again, we looked at the numbers, and we would say, if the event can facilitate, once you get in the social distancing, then we are asking persons to do so. And remember now, we do observe weddings also to see whether or not those protocols are being observed.
Thank you, Minister. A question from Stevian Simmons from Nationwide. Are communities allowed to stage football corner league competitions?
Sports.
That is a sports question, but it also, if that decision is made, I think the general question, Steven, around sporting events is being considered by the Ministry of Sports. Again, football is a contact sport, and there are opening up of the sporting sector, because over the last couple of weeks there have been some time trials for track and field at the National Stadium, and I guess more or less the playing of football, you know, is a contact sport, but once you can, I don't know, you can limit the contact in the sports, but it is something that has to be considered. You know, the Premier League have started, we have been watching the games, playing in empty stadiums and all the necessary protocols. So I think the short answer to that would be yes, in a limited way. You know, a lot of these sports will have to be played without spectators for the time being. And those are some of what we are going to be enforcing. So community games are limited in terms of spectators observing the protocols.
And let me just say that the last 2 weeks where they had the athletics meet, it was a well-executed exercise, because the organizers of the event would have submitted their proposals with all the requirements that we asked for, and they conformed. It was a no spectator event, the media were not invited, and certainly no vendors were there. And they were able to phase the athletes to run at certain times. And so those are the kind of actions that we want to see as we pay attention to the sporting events.
Thank you. Question again in relation to if the need arises that hurricane shelters need to be opened, what are the criteria for isolation areas at these shelters?
Yeah, well, we have developed the protocols, so every single shelter should have an isolation area. Those have been discussed with the Ministry of Health, and the protocols are there. So every single approved shelter should have an isolation area. The local authorities have gone through, they have done all the shelter assessment, we have had all the shelters in place, and every single shelter that would be operated throughout the hurricane season must have an isolation area. We don't want to have a situation where we are responding to a hurricane event, but while responding to the hurricane event, we are increasing the numbers of COVID-19 cases in country by not having all the protocols observed and having an outbreak in a shelter. So every single shelter should have and will have an isolation area.
And just to follow up on that, I was in Portland, I think the week before, visiting shelters, especially in Portland, where, you know, Portland has a peculiarity about it when it comes on to disaster. And already they have identified these isolation wards that will be used for our persons within a certain age group, because we are not going to mix the older population in a shelter. So those areas are established, and just to advise the person who poses that question that those exercises are well underway. The Prime Minister did, when he launched the hurricane activities, did make mention of the fact that we are going to be concentrating on establishing specialized center within the shelters for COVID response. Doctor?
Yes, I'm happy you brought that. Thank you for the question, by the way, because we have recently looked at the protocols for shelters with the Office of Disaster Preparedness and Emergency Management. And for those persons who would have accessed shelters in the past, you would now find that the protocol has changed. So when you enter a shelter, you're going to be screened and risk stratified. So if you have a respiratory type illness, you will automatically be isolated to an area and transferred to a hospital. And of course, during the process of staying in a shelter, depending on whether you need a short-term stay or a longer period of time, there will be a schedule drawn up for persons to use the common areas, the recreational areas, etc. And so I'm not sure where you are with that protocol. Has it been sent out already? But we're happy with what we have seen so far. So the business of operating a shelter has been modified, and so reflect the COVID-19 response.
Yeah, those have been sent out. The coordinators across the island have been sensitized. There has been consistent meetings along that line in regards to those protocols.
Absolutely.
So we have, in fact, made those protocols.
Okay, great. Thank you, Minister. And just to bring our attention to Section 18, it relates to the burial services, funeral services and burials. During the period July 15, 2020 to July 31st, 2020, no more than 15 persons at a time shall be permitted at any burial site, no more than 10 of whom shall be persons attending as mourners, and burials may only be conducted between the hours of 9 a.m. and 4 p.m. And the time for conducting the burial shall be no longer than 30 minutes. I don't know if you want to expound on that, Minister, because...
Well, that is important, because also that protocol that I announced a couple of months ago came out of a meeting that I had with the undertakers who actually recommended the time. We had a longer time, but it came out of the undertakers. But let me say that that is one area that is of real concern to us, where we have seen a falling off of observing those protocols, where burials now have become even larger than the actual service in the church itself. And we again have advised the police, and the police have been moving around and have been taking action. So again, we're just saying to persons that these protocols are still in place, and we are asking for persons to observe. Because if the government is forced to, then we will have to put tighter restrictions on funerals if it becomes necessary. Because I want to remind the country that our first case of COVID came out of a funeral.
Indeed, Minister. There is another question coming in, Minister, in relation to banks and financial institutions. More so, I don't want to call the name of the remittance service outlets. There has been right across many areas, there's no practice of social distancing, no wearing of masks, no enforcement of the orders. Is there any view that you have on this, Minister, to deal with the crowding and bunching up at the entrances to remittance service centers?
You know, the banking sector is exempt under the order to operate. And I know of some banks and some financial institutions that have sought and have gotten permission to establish temporary holding areas in order to facilitate persons who are going into their institutions to sit and wait and to do so in an orderly fashion. We are getting the complaints, and it is a matter that is down to be discussed at the next meeting of the subcommittee of cabinet on the COVID response, because I think that is an area of real concern. Another area of concern, which I noticed and I've seen several questions around it, whether or not we are going to allow churches who have air conditioning units to use air conditioning units within the church. The answer to that is no at this time, because you can't make the comparison of a church and a supermarket. You spend half an hour in a supermarket, but you go to church, you spend an hour, 2 hours. And the same reason why we are not allowing nightclubs to operate, because of the circulation, using the air conditioning, is the similar thing we are saying to the churches: you can operate for as long as you want, observing the protocols, but one area we are asking you not to, and it is the use of air conditioning within the church.
Thank you, Minister. And we did speak about wedding ceremonies earlier. The order speaks to Section 20A and B, speaks to persons not gathered more than every 36 square feet and shall be permitted to gather at any one time during the ceremony, inclusive of the person conducting the ceremony. But regardless of the size of the area, the gathering shall not exceed 50 persons at any time. Minister, you did speak to that already. And we also spoke to the small outdoor events. I have a question that came into me directly, Minister. I will not call the name of the school for obvious reasons, but it says here, I am worried about a Manning Cup, as I need to ensure that, quote unquote, the school, his school, wins a back-to-back title as he did last year. So, Minister,
I will say that the protocol around the question of sporting events in general, schoolboy football, we postponed athletics championships because of the crowd situation. As I said in response to the question from Nationwide, the question of sporting events will be looked at. The economy is being opened. Once again, whatever decision we make as a country will depend on the remaining period for the month of July, looking at our numbers. So we can put all the plans in place. If the numbers get out of control, then the government will have. And I heard the senior medical, the chief medical officer on a radio station saying that the country would have to be pulled back.
Absolutely.
If we get out of control. And the measures that we have put in place for the holding of events say that you must obtain the requisite permit for these events. One, the municipal corporations must issue an amusement or license or a permit to operate. you must have the fire safety report to say that that is so. The Ministry of Health, all the protocols, and these events that we are talking about, whether it is an uptown or a downtown event, the same thing goes right across, because we cannot, and I want to make the point, ladies and gentlemen, it is critical. We cannot afford to lose the gains that we have made as a country in the fight against COVID-19. We are one of very few countries in the world where our infirmaries have stood up and have remained free. So we are enjoying good results based on sacrifice. But those sacrifices can be eroded if we are not careful. And I think for the last 10 minutes of this program, I think the message that should come from all of us here on the panel is how to sustain, maintain the gains that we have made so far. So, Mr. Thompson, in 2 minutes.
Thank you, Minister. You have said it, sir, and I said it at the outset, that the role of the government and the role of the agents of the state is not based on any person's economic situation or color or creed. It's based on the country and what we have to do to ensure that we are protecting the people of the country and the economic well-being of the country. So every single measure, every single protocol that we have put in place is with a view to that. And we are asking the public to ensure that they are following through on the protocol, because as we're saying, COVID is still keeping, and persons need to realize that, need to take heed from what they're seeing globally, and ensure that as a country, as Jamaica land we love, that we are protecting the gains that we have made, and that we are advancing our response to a very infectious disease in COVID-19.
Dr. Bernard?
Yeah, thanks, Minister. Just before I speak quickly on the mechanism we have in place for monitoring, just to state that amusement parks have been open, water parks, and I just want to read one protocol quickly, and that towels, goggles, snorkels, and other like personal equipment shall not be provided by the operators. People must bring these themselves. It's very important when you're going to do these places. But in terms of sustaining the gains, Minister, in the ministry we have established a protocol team. That we have a core team here, and also in each parish we're establishing parish protocol teams comprising the SDC, the JCF, Ministry of Health officials, when it is that we can really get the time because I know how busy they are, Jamaica Fire Brigade, etc., and other community persons. The inter-agency networks that are there are actually manning this. And we have employed thus far over 200 protocol wardens, and more will be added, just to ensure that not only do we monitor, but we also sensitize and help persons to understand what the responsibilities are. And certainly if we keep that up, I am confident, Minister, that the gains will not be eroded.
Dr. Gamble?
Thank you so much, Minister. The Ministry of Health and Wellness, we are here to protect and to serve and to make sure that your public health interest is maintained. And I say that to say that we have made great strides so far in keeping the numbers below what was actually predicted. We are now in another phase where we have brought in probably 40,000 or close to 40,000 Jamaicans back onto our shores with a positive number of, say, I think it's 270 or close to that. We require persons to be vigilant in the community, because right now our thrust is to prevent the community transmission. Remember, if we do not get this right, we have to revert back to the austere measures that were taken in the past. And I'm sure many of you do not want to go back there. We certainly don't. Many of us have been working beyond the call of duty to ensure that this country stays below the curve. So I implore persons to report infractions and violations that they see into the Ministry of Health's hotline, into the JCF's command center, because believe me, they do act when they get the calls. So remain vigilant, let's get over this together and keep our country COVID-free.
Minister, I want to take a few seconds to speak to my colleagues in the entertainment industry. This is a critical week. Our entertainment industry has opened up just this Tuesday, and this is our first weekend of entertainment activity. And I'm going to plead everybody. We are all stakeholders, the industry is ours, and we have to manage it for ourselves. Government puts down guidelines, and if we mismanage it, then they're going to put down stricter and stricter guidelines. What do those guidelines mean? Let me be specific. Ensure that all patrons entering your events or establishments wear a mask. Ensure that you temperature check everybody and sanitize everybody, their hands when going inside. And make sure that you as the promoter, event organizer, do not do anything that encourages people to come together and reduce that social distancing. Tell your DJs, selectors, to make sure that they do not do anything that would violate that. Actually, converse is true, where you tell those persons to actually make their people that they're entertaining stay far from each other, enjoy themselves as a couple, or just the simple group that they arrive with, and they can enjoy themselves healthily and safely. And if we continue to do this, we'll make great strides, and we can move quickly into phase 2, which I'm very looking forward to, Minister.
Well, you just touch on some areas which is important. The promoters, and when we were here in the same room a couple of weeks ago, when I look at someone who was here and how they spoke passionately about reopening the sector and the importance of the sector to the economy. And while we all sit back and reminisce on the good old days of the Jamaican dance or the Jamaican music, but we must also look now down the road where we're going, because one of the things that COVID has taught us, that it will not be business as usual. Many of the things that we did in the month of December, even up to January, we are not going to be able to do those things in short order. And today we looked at the general state of the reopening of especially this sector, which is critical. We have seen, we have heard the cry. Persons have written to us asking a lot of questions, wanting more. We cannot give all at once. We are giving as best as we can now under the circumstances. Have to be mindful of the pressures that we are bringing to bear on the medical service, which we have to rely on. And a point that has been made, which a lot of people seem to have lost sight of, is that if our medical system comes under severe pressure, then it means they have to drop what they are doing and pay attention to those concerns. So, on that note, I want to urge all Jamaicans to be responsible. Wear your mask. Observe the social distancing. Follow the protocols that are observed, because the life that you save may be yours or your family, but what you do in terms of responding to the call is that you are offering protection and service to a wider cross-section of Jamaicans.
Thank you, Minister, and thank you to our expert panel, Mr. Richard Thompson, Director General of the ODPEM, Dr. Dwayne Vernon, Executive Director of the Social Development Commission, Mr. Kamal Banki, Member of the Entertainment Advisory Board, Dr. Curdell Espinosa Campbell, Acting Director of Emergency Medical Services in the Ministry of Health. As we close, I'd like to bring your attention again to the specific orders that have been published. They can be found on the ministry's website. That's localgovjamaica.org. localgovjamaica.gov.jm. That's localgovjamaica.gov.jm. We want to extend our thanks. Oh, I'd like to go back to Honorable Minister, just for another closing comment.
Before we close, just want to remind the audience that I'm inviting you to join us back next week, Thursday, here when we will be reviewing the performance of the Ministry of Local Government through the various entities, the National Solid Waste Management Authority, the Jamaica Fire Brigade, the SDC, the ODPEM, and the Board of Supervision will be here to give an overview of the performance of the Ministry of Local Government. That is next week, Thursday, same place, same time.
Thank you, Minister. This has been the Ministry of Local Government and Community Development's digital town hall on the reopening of the country's economy on considering the COVID-19 pandemic. We would like to thank everyone who had tuned in or participated and keep the safety protocols going. Thank you very much.
Officials from the municipal corporations, the Jamaica Constabulary Force, the Social Development Commission, and the Ministry of Health and Wellness are currently carrying out inspections to ensure that bars are adhering to new protocols for operating. These readiness assessments are being done ahead of the reopening of bars for 2 weeks, starting Tuesday, May 19. The local government ministry gave bars 7 days, beginning on May 12, to ensure they are compliant with the new measures aimed at protecting the public from the spread of COVID-19.
From what we have observed and in our assessment, most bars are in preparation mode.
So this activity also doubles as a public education campaign. So we also have posters and flyers that we have been sharing with the bar owners. We are also sharing these information with the general public so they are aware that if and when they visit one of these establishments, they are aware of the protocols to be observed.
Bar operators must ensure that social distancing is maintained while bars are open. No more than 5 persons, including the bartender, are to be in the bar at any one time. There should be no chairs, benches, tables, or stools inside the bars for patrons. Seating is allowed outside, but must be positioned 6 feet apart. There should be no games, such as dominoes, while poker boxes and other gaming devices must be placed 6 feet apart to maintain social distancing.
Most importantly, all exterior doors and windows should remain open during operation hours. If bars have air conditioning units, it is encouraged that all of these units remain off due to the nature of this virus and the circulation of the air.
All patrons entering bars must wear face masks, and bartenders must wear personal and protective clothing to include a face shield. Each bar should also establish a sanitization station for hand washing. In the meantime, several bar operators have welcomed the government's decision to reopen bars. They say they are willing to make the changes to reopen their businesses.
It's rough bad, we're glad. Glad for the reopening of the bar, and we're glad to the Prime Minister reconsider us. So we have major part of the business and things. So we comply, we try whatever and say we don't have no chance, we just have to comply and hope say boy better may come.
Give thanks to God for the opening of bars again, and we hope that everyone obey by the guidelines, sanitize your hand, keep yourself clean, and always wear a mask.
And one bar owner says he's willing to close his business if the measures are not complied with.
Just the behavior pattern of the bar customers, you know. So once they fall in line and obey the rule and the sign, no problem. But if they tend to go overboard and violate the system, I don't have no idea but to just close it down.